Hello everyone, welcome back to the Sharmit podcast. Today I am here with another special guest, Dr. Sachin Jhawar, who is joining us from India itself. If I talk about Dr. Sachin, then he is the director at Apex Hospital, a renowned surgeon, entrepreneur, and a healthcare leader. Beyond his clinical expertise, Dr. Jhawar has been a mentor, author, and a leader in multiple medical associations, and constantly advocating for the innovation, emotional intelligence, and a patient centric care. So, today in this episode, we are going to explore Dr. Sachin's journey from surgeon to visionary leader, and also we are going to talk about the story behind founding the Apex Hospital. So, but before we proceed further with this podcast, I would like to thank Dr. Sachin for joining us today in this episode. And now I request you to please initiate the discussion by telling us a bit about yourself.
Yes, so very happy to be here and be on this platform. So basically, as you asked, who am I? So I'm a surgeon qualified from SMS Medical College, Jaipur, come from a family of doctors. And basically, I think I'm a teacher, trainer, fighter, innovator, and a healthcare. I would not say use the word entrepreneur. I'm a healthcare enthusiast. That is how I would like to, describe myself.
Okay. All right. So let's start from the discussion with the introduction itself because we all know you as a surgeon and a healthcare leader, hospital director. But let's strip away all these titles, these degrees, and the positions. And now tell me, like, who is Sachin Jhawar? So, suppose I met you outside the hospital walls. How would you introduce yourself
Mm.
as just as a Sachin?
So basically, I see more of myself like a sportsman than a
Okay.
healthcare professional. Whatever qualities I appreciate those qualities in myself. So I would say I'm a healthcare, not a healthcare professional, but
Mhm.
actually a sports person who loves teamwork, who loves the tough workout, who loves the winning. That is what I would like to describe myself, and that is what you would probably see in my sort of lot of thinking as well.
Okay. So Dr. Sachin, I'm sure, like not only from Jaipur, but people that are not from Jaipur, they also know about the Apex Hospital and his contribution for the healthcare domain. But I just wanted to know about that particular day, like when your family decided that yes, it's the time to come up with this hospital, and I just want to just help us to draw that or imagine us that day, like where your family decided that yes, it's time to start with this Apex Hospital, and what was the idea, how you started it all.
So good, the journey of Apex has got a very humble beginning, as it is with lots of first generation entrepreneurs. So my late mother and my father, they began their journey in a small town in Ganganagar district. My father was in a government job. My mother was busy taking care of the family. And suddenly there was an urge to have better education for their kids, and that made them move to Jaipur. And they were looking for opportunities. So it is also a story of, not actually deciding on what to do, but as entrepreneurial lesson, it is something which is very important, that what is the opportunity that you are having, and
Hmm.
you realistically give that opportunity a very big shot. So my father got this opportunity of starting a ultrasound clinic. That was again an innovative step at that time in 1984-85, because nobody was doing it. And then this story progresses gradually, whereas you should not be sitting on your laurels and be comfortable. So being uncomfortable constantly is the door to progress in life. That is what he did from a clinic. Then he went to a small nursing home, And see, all of us, we think where we are going to be in the next 5 years, 10 years, 15 years, what do we want?
Mhm.
But life has its own sort of, course path. And I firmly believe that there is destiny which plays a very important role, which does not mean that you should just keep, keep looking at the destiny and what it has. But what I feel is when your gut feeling or your subconscious mind tells you to say something, if you sincerely follow that, most of the people will get success. So this word apex and this company also did not belong to my father, and he inherited sort of, he took this company from somebody, and
Okay.
the rest is all history.
Okay, so maybe I think there was some network glitch, but fine. Moving ahead, let's talk bit about more of your innovations, because during like after starting this Apex Hospital, there were plenty of things in which plenty of ways through which you have contributed for the healthcare industry. And one of the interesting thing, or one of the very innovative thing I found about the Apex Hospital and your contribution is the laparoscopic hernia repair. So you introduced the
Mhm.
first laparoscopic hernia repair and gastric bending in Rajasthan. So how does it feel to
Yeah.
become to be the first to bring something so advanced to the region?
So as I told you, that it's very interesting. This whole thing is that when an entrepreneur is actually basically he has this desire to have wins.
Hmm.
When I say wins, it does not mean winning like in a war. An entrepreneur is at a constant battle with himself or herself and wants to improve. And the best way to do it, to keep innovating and do something new. So, as a true entrepreneur, a true healthcare professional, I also wanted that people of Rajasthan, people of Jaipur should get the best technology, and at the same time, it should give me that satisfaction that I am getting something new to the society. And this is what has been pushing me throughout my career for more learning, for making better network, for getting better equipment. So where I am today, tomorrow, wanting to get better, and I think that is the methodology to survive in this hyper competitive world.
Yes. Okay. All right. So now we will talk bit about your role as a doctor, because we I believe that hospitals are not just about the doctors; they are about the system, management, and vision also. So what
Yeah.
do you think? Like, what is the most underrated skill a doctor needs to uh, underrated skill a doctor needs to succeed in their life? What one skill you would suggest to all the young professionals?
See, in basically in a healthcare scenario today,
Mm-hmm.
the body language of the doctor is something which gives a lot of confidence not only to the patients
Mm-hmm.
but also to the people working around the with the doctor. So a body language of a doctor, how he walks, how he talks, how he presents himself, how he dresses, it is something which has become very underrated in today's world. If you see doctors of the past, they were slightly more sort of more concerned about their body language, and the doctors of today have become a bit casual. But I would say to any entrepreneur, you should be, when you get up in the morning, you should feel that, today is the day I will be signing the biggest deal of my life. And you have to be dressed like that. You have to have that enthusiasm. You have to have that body language. You have to have that energy. And that is how you should approach your every day. And that is what is very important in a doctor, because sometimes the patient, see, 95% of what a patient perceives as body language is only 5% is the communication with doctor does. And that 5% communication is also very important. What the doctor speaks, what is the science behind it, what is the way, and he has to be a very, very good listener, not only for his patient, but also the people who are working around. So, body language, communication, and listening. These three things are something which were important yesterday, which are important today, and which will be important tomorrow as well.
Completely agree here because not only for the healthcare profession, even if you are in different domain or different sectors, body language and communication skill are something that played a vital role. So I'm also agree with this point that yes, everyone, especially the doctors, as you mentioned, that it is going to impact not only the patient but also the staff with which the person is working with. So that's a good point. Okay, so now moving further, I will talk bit about your exposure on abroad countries because you have worked and trained in UK, France, and United States, and also consulted in Oman. So, what one big difference you have noticed between the healthcare abroad and in India?
So, see, I feel that about 70% of the doctors
Mm-hmm.
in, say, in the Middle East, about 20% of doctors in US and UK, they are either Indian or of Indian origin. I am 100% sure with my experience, and I'm sure data will back it, that the skill of an Indian doctor and the education of the Indian doctor is no way less than anywhere else in the world. But the processes and the steps, systems that he follows when he is there abroad are much more patient centric than they are in India. And let us not hide behind, workload here. A
Yes.
doctor in sitting in India anywhere can make his or her systems patient centric and have a level of empathy for doctors, for patients, which are desirable of the highest standard. And see, it's not a matter of how much time one doctor is giving. And I will tell you, doctors even abroad are busy and they are seeing multiple patients. It's not just that in India we are seeing hundreds of patients. There are people in the Western world, but they have their processes, systems, and staff that are so trained that every patient feels safe, every patient feels as if he's been taken care of to the best of the capability. And here I will say that healthcare is very like airline industry, and a doctor is like a pilot. So a
Okay.
pilot in India and a pilot anywhere in the world has to follow the same set of rules. He cannot say that just because I'm in India and there are so many flights and so many passengers and so many things that I will have to treat my passengers or patients differently. That cannot be done. So that is one thing which has to improve immensely in India as well now.
Yes, and I would say that I love this example or the correlation between the pilot and the doctor because it's completely right thing that yes, you have to follow the certain set of rules in order to operate or to board a flight. So this is something that yes, it has the similarity, and I am sure like this example will resonate with other listeners also. Okay, so now, Dr. Sachin, I would like to ask one thing. Suppose if you had the power to change one thing in India healthcare system overnight, so what would be it? What would it be, and what department it is going to impact?
See, again, a very interesting thought. And I think the leaders, the bureaucrats, and the policy makers have to listen to this. A doctor is only the director of the movie of healthcare or a hospital function.
Hmm.
The real actors are the nurses who are delivering healthcare to the patient. In a Gallup survey in UK, for the last about 40 years, nurses fall in the top three category. Uh, and they fight with firemen, teachers, and then their nurses. They're so very well respected, and this does not mean that they are paid, one of the highest. No, this, respect for profession has got nothing to do with nursing, nothing to do with payment.
Okay.
What I see is that the nursing profession in India is not respected as it should be. It was briefly for a period of COVID, but if you and I talk and we ask a kid or a young person, what do you want to become? And if we say, yeah, I want to become a nurse, it is actually looked down upon in India. In all honesty, why can't you become a doctor or a lawyer or a professional or something IT professional?
Yes.
That narrative needs to change very fast and completely, because healthcare is one of the largest employers not only in India but in the world. And if we have to deliver world class health care, we need we need to give respect to this very vital cog in the health hospital industry. So I would change this one thing in whatever way I can.
Yeah, and this change is necessary because we all know that they are the frontliners. Like whenever a patient visited hospital, they are the first one like who try to help them patient with their first aid and they always make sure to provide the better results to the disease or whatever concern they are. So everyone should respect not only the nurses but the entire staff of the hospitals because they all are doing it not just for the sake of money. They are in the service of like they want to serve, and that is why they are into this particular domain. So this change should be
And
implemented.
the important bit is that they realize that their sort of their respect in the society is not as much as
Hmm.
it should be. And if you're a nurse, and if you know that you're not being as respected as some other profession, it would be slightly difficult for you to give your 100%.
Right.
So I think that is something which is very important that needs to change. If you want our healthcare to change, if you want our nurses to have an empathetic attitude towards patients, we need to give them all the respect that they fully deserve.
Yes, we should. Okay, moving ahead, we will talk about your another role that is a mentor. Because as a mentor and a leader in multiple medical association, what do you think the next generation of doctors should focus beyond the textbooks? Because now in the era of AI and in the advanced thing, what are few things that you believe that the young generation of doctors should focus beyond the textbooks and all these things? Sure.
So as a so I interesting thought. And what I want to tell the juniors is that our role as doctors in the society has graduated from being a confidant, which we were 100 years ago when we were family doctors. We were going to their houses, giving them medicine. Then that one doctor would treat the grandfather as well as the newborn child and talk to the family and make them comfortable and be a part of that family ecosystem, the neighborhood ecosystem.
Mm-hmm.
Because medicines were few, the doctor had much more than just giving medicine. He was people would idolize the doctor, and they would respect the doctor in a different way. In the 40s and the 50s, when experts came in, when people became gynecologists and pediatricians and cardiologists and orthopedic surgeons, the doctor was seen for his expertise, for his skill. And so they were experts. Everybody wanted to become an expert so that patient would seek their advice. And now we are activists because we are all experts now, we are all very well educated now. So an activist is Not only skilled in doing treatment, he's doing podcast, he's talking about preventive health, he's talking about prevention, he's in the groups, he's a role model for doctor, a role model for the society. He's doing several things. So you have to have a network. You have to be able to inspire people in a way where you have chosen to live your life uh, in a way that when people look at you, they think that this is how your body and your health should be respected, not only by what you treat, but what you talk and what you do in your life.
Okay. All right. So now I would like to talk about one case that I found in one of the article, where I found that there was one article where it was mentioned that one patient was suffering from a diabetes, and in that case, like their family member mentioned that the patient is terrified by the hospitals and the doctors. So whenever like they ask the patient to visit doctor or to for the checkups, they keep avoiding the checkups and visiting the hospital and treatment, all those things. Basically we can say that fear wins over the health. So now in such cases, like what role can the family play to support in such patients, and how the doctors can help in these particular scenarios?
So this question has been asked to me in a few times by
Okay.
real-time families. It's not a hypothetical question.
Okay.
And what I would say is that first thing is that every person, every adult in India should have a health insurance.
Mhm.
With the health insurance comes a preventive health check. So that is the first step.
Right.
That yearly you are having a preventive health check, you have to get it because of your health insurance. And I feel that health insurance is much more important than the term insurance or anything else. Your health insurance costs nothing. All of us should have a proper health insurance. The second thing is there are several podcasts and books and seminars that are happening.
Hmm.
Families should discuss health issues around, families should discuss about food, families should discuss about, what to eat, what not to eat, what is good for blood
Right.
pressure, what fruit is good for, which has more dietary fiber. This should be a common thing where families happen. And the third thing is that yes, we are in the era of experts and activists, but families should have a family doctor who should be the first point of contact, and we should be very free going and talking to him about these sort of issues.
Okay. Okay, so now we will talk bit about the support of system, right? Because we all know that behind every successful person there is a network of support. So we all know
Hmm.
that as a doctor, as a mentor, you have to touch so many lives. But in your case, like who were those key people around you who helped you in your journey, throughout your journey?
So I would take you through a very small little story which my father always says
Mm-hmm.
that in the Yuddha of Mahabharata, Arjun told Sri Krishna, see, when I am firing, Karan's chariot is going 2 meters back, 3 meters back, 4 meters back, and when Karan is firing, my chariot is not even moving.
Hmm.
So Sri Krishna told Arjun that Arjun, the chases of your chariot is Sheshna. The horses of your chariot are the Indra's horses that have been given to you.
Right.
The on the top of your chariot is Hanuman, and I am myself, running your as a driver or charioteer. I am running your chariot. If we were not there, our current arrows would knock you off 200 meters.
Right.
That is the same thing my father says that, it is the family, not just my parents, but, my brother, spouse, kids, and extended family of a lot of people who work. So I would never tell Siddhant that, for people who are working in Apexes, he works for Apex. We are colleagues. The colleagues I'm working with have had a very big role.
Mm-hmm.
There have been teachers. namely Dr. Jindal, who has really been very, bless, God bless his soul. And in the entrepreneurial journey, there have been people like Gopi Garwal Saab, Ramesh Kanat, who have shaped the thinking of as to how a modern business, of how an entrepreneur, of how an activist need to think. So there are several people in this journey who have made all of this possible.
Okay. All right. So now, although like we have plenty of things that we can discuss here over the healthcare and other things also, but we have limited time. So I would like to ask my last question, and this is related to one of your book which you launched recently, uh, Shubdin, Shuddin.
Hmm.
So which is on emotional intelligence in healthcare. So could you please tell us a bit more about this book, like what it is all about, and why do you believe that EQ is important for the better outcomes?
So, see, it all started in during COVID when we were not being able to talk to people, meet people, and I thought that and every day mattered. So
Mhm.
I thought that why not just give a positive thought to everybody, especially for Apex. And so because we were all, we would not know what was there in store today. Any of us could fall on, for everybody were treated with, treated patients with COVID. So I wanted to give that positive outlook. So, that is how it started. And at the end of 2022, I compiled all those thoughts and, gave it the shape of gave it the shape of my first book. So then, 2022, 23 first book, 24 second, and 25 third book. This is my third book. So first was Shubdin. The second is, Shubdin. The final one is Shubdin Ik Safar.
Okay.
So what I feel is that, see, books are something, as God has also told that, if you have to have Gyan, you have to read Gita. You cannot go in Ganga, get your dip. You can, आपके पाप धुल जाएंगे, but you will not be able to, take Gyan. So in a mandir, you can go for meditation, but for Gyan, you will have to read a book,
You have to read.
which is sort of, in our mythology, it's Bhagavad Gita. And so, what I also feel is for making yourself a better human being, you need books. And that is the reason why I thought that we should compile it in form of a book where people can go read and reflect back on this happened with me. I could have done this and I could have made myself better. That is what. So what I feel is podcasts are good, movies are very good, but books give you time to sort of read a chapter or read one or two pages, then think about them, pause, and then go to the next thing. You can do it at your own time. In a podcast, it's not very easy to stop the podcast after every few minutes and think about it. So what I feel is that to develop EQ, which is a relationship between your thought and what your heart is doing, a book is a very important tool.
Right. Okay. Yeah, so thank you so much, Dr. Sachin, for joining us in this episode and for sharing so much information regarding the healthcare domain and for sharing the story behind the Apex Hospital. It was really very engaging discussion, and I hope you also enjoyed the discussion. So thank you once again for being
I
a part of
really
this.
loved it.
Thank
Loved
you.
it. Loved it. Thank you very much.